Good evening, everybody. My name is Eding, and I'm an anesthesiologist. I'm also a yoga medicine yoga teacher, and I'm here live for you to make sure that I can answer all the questions that you might have concerning the coronavirus, or what it's commonly called as COVID-19. I've had a few questions asked before logging in tonight, just to have a little bit more information about some specific topics related to the coronavirus. So I'm just gonna jump right in and go ahead, and I'm waiting for your questions, and hopefully I see some familiar names and faces. Hi, Melissa. So my first question actually is a very important one. It's about the virus being passed on by someone that's breathing. Can it be passed on that way? The answer is yes. Major, huge yes. This is not an aerosolized virus, meaning it's not something that is diffusing freely in the air. What it means is that it's droplets that can actually infect people that are within reach, which is typically measured at about 1 meter or 3 feet. So if you're within reach of someone that is at that distance, there's a big chance that if they cough into your face, or if they sneeze, or if even they vomit, there might be some droplets that land on you. So you have to be a lot more careful in those instances to make sure that you wash your face, you wash your hands, and you won't have the virus left on you at that point. I want to introduce myself a little bit more. Maybe some of you are wondering why I was asked to take part of this little podcast. In my real life day job, I'm an anesthesiologist, so I'm a specialist in critical care and also airway management. With crises like this, we're basically on the forefront of whatever could happen. We could have patients with COVID showing up for surgery, or we can ask to be helped in terms of ventilating those patients or intubating them in the emergency room if ever they were caught in a critical case of airway or respiratory failure. So that's why I'm keeping myself very much so up to date on the topic, to make sure that anything that is being done for patients coming into the hospital is going to be appropriate and is going to help out those patients with the best of my knowledge. So that's explaining a little bit more why I'm doing the podcast. Now, I've had a couple more questions here regarding the use of cleaning products, the use of hand sanitizers. Basically, what needs to be done is really having good sanitary hygiene, washing your hands religiously for anything, being very wary of putting your hands on your face or putting your hands near your eyes, to make sure that you're not getting infected by any virus that could be left over on surfaces. It could live up to 12 to 15 hours, sometimes as long as 24 hours on very hard surfaces. Anything that's porous, it could be not as long. It hasn't been calculated in terms of duration, but it could live on your kitchen counter, not even knowing, for up to half a day. So you have to be careful washing your hands. Once again, washing your hands. Purell or any type of sanitary gel is also an option that could be used, but is not as good as the gold standard of washing your hands. You have to protect yourself. You really have to wash your hands for at least 20 seconds with soap and water. And you have to look at all the little nooks and crevices on your hands and make sure they're really clean. You dry your hands with paper towels. You don't use a regular towel, which could be contaminated by someone walking in and having used it before you. And you throw the towel away once everything is done. That's one of the best ways to protect yourself. Second way is, if you don't feel well, do not go out to infect other people. You stay at home. if you feel so unwell that you actually need to leave the house, you protect yourself, you go to the emergency room, you try not to cough on anybody. If you need to cough or you need to sneeze, you use the crook of your elbow to do so as not to spread droplets everywhere around you. So that is very, very important that you try and keep your germs to yourself and not spread them into the community. At this point, there is no known cure for this virus. So as you might have seen, it's basically spreading everywhere. People are very panicked about it because nobody really knows when the onset of symptoms are, how long you're contagious for, at what stage you become contagious, how long you're going to stay contagious, and if you can catch it again at some point later down the road. What is being observed from studies done in China right now, study done in South Korea, we're looking also at the Singapore data and at the Italian data, you could be asymptomatic from at least 48 hours to up to 5 days prior to actually showing either fever, starting to cough, having muscle aches, feeling very unwell, and having to present to the emergency room. Hence the importance of really, really making sure that you keep everything clean and you wash your hands and you cough into the crook of your elbow. Face masks are not a solution. I'm going to repeat this. Face masks are not a solution. They're only there to protect yourself. They're not protecting anybody around you. And also, technically, you should have to change your face mask every hour. So it's not a viable option here. You really have to make sure that you clean everything that needs to be clean here and you disinfect it. If you want to disinfect something, a surface, you have to use a solution that's at least 70% alcohol based in order to kill the virus. One more tidbit of information about killing something. It needs to stay on the surface for at least a minute for it to be dead. So if you wipe something down and then you lay something on it right away, virus might not be dead at that point. Okay, so for the question about can it live on clothing, the answer here is yes. Do we know how long? No. So if you work in a healthcare environment and you go home at night, your family's at home, make sure that if possible, you could undress in a little room that is not directly into the house. And you could put that the clothing in the washing machine. You could take a shower before you actually interact with the rest of your family, just to make sure to be careful not to spread anything around in the house. There's a lot of questions about people asking if they could go to the yoga studio or if they should go to the gym or if they should go out. I know where I am from and where I live in Canada. We're pretty much on lockdown right now since last week. So everything is closed. We are proning, well, what is being done here is what we call extreme social distancing, meaning that it doesn't mean that you can't talk to your people, you can't talk to your family, you can't connect with people online. It just means that you want to keep as much distance between yourself and someone else to make sure that if ever you were to become contagious, you're not going to spread it to somebody else. It doesn't mean that you have to cut all ties with everything around you. You do need that support during these really hard times. You do need your yoga practice. You do need to exercise. Those are tools that are going to help you manage with the stress, that are going to help you build up your immune system to make sure that you remain healthy and that you're able to fight the virus. So I would suggest then that if you're not on lockdown at this point, wherever you are in the world, to stay away still from gyms, from yoga studios, just to make sure that you're not spreading anything around. The most vulnerable people are the elderly. They're the ones that we're trying to protect when we're doing this. So, I'm looking at, there's something very interesting.
Answer Kayla says his question.
Kayla says, okay. So Kayla says has a question that says, I have asthma and I work in treatment. I am a yoga instructor. They want me to come in and teach. I'm just getting over being sick with a cold. I'm afraid to work. What do you suggest? At this point, if where you're working is not in lockdown, meaning your yoga studio is not closed, if you can at all costs avoid going back, that would be the best thing for you, especially if you're just coming off a cold. Your immune system is probably not up to par at this point. You don't want to stress it further by catching something. And plus, if you have breathing issues, which could potentially be a risk factor for the virus. I'm not saying that it is one. There are still conducing studies about all that stuff. But I would try and stay away from going to the studio just to make sure that you remain safe. However, once you feel that everything is okay, depending on your policies at work at the studio, then that's something that you'll need to discuss with them, because in these times where we're really asking for people to stay home, to not spread the virus to the most vulnerable people, you don't want to expose yourself to anything that could be detrimental to your health. Now, I have another excellent question. You guys are asking so many excellent questions. I can barely keep up. I've read up so much about this. I've had no choice, actually. Every hour I get new papers to read. So, yeah, and it's my first Instagram Live ever, so I'm a little bit nervous, but everything is going well, I think. So, Metcal is asking, anti-inflammatories. I've heard that we shouldn't take these. What role does inflammation play in this virus? This is the question. This is the topic of the hour. So, a lot of research has been done at this point, looking at the anti-inflammatories. None of the research done is a randomized controlled trial, meaning they don't have two groups of patients looking at people taking anti-inflammatories and another group that's not taking them and seeing what the outcomes is in both groups. What they have in terms of results are observations that have been found out in France and Austria, that young patients coming in with respiratory failure needing to be intubated in the intensive care presented with a worse outcome if they had taken anti-inflammatories at the onset of their symptoms. So if I repeat this, basically, these younger people had taken ibuprofen or Advil before they presented to the hospital because they weren't feeling well. And when they looked retrospectively at what they had taken before needing to be intubated because their health status declined, they noticed that anti-inflammatories were taken. Now, anti-inflammatories, the way they work is on special receptors in the lungs. It's highly, highly technical. I'm not going to get into this. But what's being suggested at this point is if you can avoid it, don't take them, period. If you're chronically on anti-inflammatories, or if you're taking corticosteroids for a chronic condition, you have to keep taking them. It doesn't mean that you're going to be infected by the COVID. If you need them in order to function and you've been taking them chronically, do not stop them just thinking that you might get worse with COVID. This is a case that needs to be discussed specifically with your primary healthcare physician in order to determine what could be good for you if ever you were stricken by the virus. But if you can avoid taking them, if you're not feeling well, then do not take them. I also wanted to mention that English is my second language, but I don't know. I'm managing, I guess. So
from Italy and from Barcelona, and they're both on lockdown, and it's really bad.
Okay, so we have yogis here from Italy and Barcelona. I am completely 1,000% with you. We're reading everything that you guys are going through. I'm on 6 different doctor groups right now discussing what needs to be done for critical care for patients and for airway care for patients, and what kind of measures we need to put in our hospitals to make sure that there's no spread of the virus. I send you all my positive vibes. I don't really have an idea of how horrible it is, but just having to deal with what we have to deal right now in Canada, where we don't have that many cases, but we're trying to be proactive about it, is already horrendous. So I can't imagine what you guys are going through. And definitely I want to send out a shout out, and hopefully you guys are keeping safe and you guys are staying home. You're well, and you're watching what you're doing in order not to get sick and not to get infected.
Around you.
And also protecting the people around you. Some of the risk factors for catching this virus are elderly people or people with a deficient immune system, people that have diabetes, people that already have pulmonary issues, people that have congestive heart failure. There is quite a number of conditions that you can read about on the World Health Organization webpage that has all the information about the COVID. If you're in the healthcare professions, you can look up everything that is up to date about the COVID on a special resource that's actually called Up to Date, that they update very regularly, that gives all the information about all pathologies, viruses, how to treat, what has been found, and also names the sources of studies that have been done up to this point. So if you're in Canada, there is on Health Canada, you can read all about what's being done and all the latest precautions that need to be taken. Whereas if you're in the US, there's a CDC that you could, the webpage where you could look at everything, all the advances that are being done at this point, especially talking about the virus and a potential vaccine that's unfortunately not going to be out for at least another 12 months, but it's something that needs to be addressed. Okay.
From there, where is everyone else?
Okay, so from what I've noticed here, there's a lot of people from different places. We have people from Norway, Finland, the Netherlands, Spain, Italy, Canada. I'm presuming the United States. Are there people from anywhere else? It'd be very interesting to have your take on how COVID is affecting you. One thing that I'd like to stress is that we're all in the same boat. We're all part of a community. We're all part of the yoga medicine family. And if ever you need help, you need support, by all means, reach out. We're here to support each other. This is a time where you could become a little bit more introspective. You can try and foster more your relationships with other people on a one-on-one basis. And the internet is a good way to reach out, as well as phone calls, snail mail if you want to. It's a time to try and connect and support each other from all over the world. So by all means, reach out. It's a pleasure. Don't be shy. One more question I had here was, how can one build immunity against viruses? So one of the things I'm going to say is make sure you have all your vaccines up to date. I know there might be some people that are not for vaccines, but when we look at what is happening right now, this is not a case of, it's not about herd immunity with what is happening with the COVID. It really is about if you get it and you give it to someone else, that person could potentially die. Mortality rates at this point have somewhat been determined based on what has happened in China, what has happened in South Korea, what is going on in Italy. But it's very, very, very hard to have a very specific estimate of the numbers, because we don't know what the denominator is. When I talk about the denominator, whoa, this is a hard one for me. I talk about the number of people that could potentially be infected. Younger children, as well as teenagers and young adults up to about the age of 40, can be asymptomatic carriers of the virus, meaning they can go about their lives like nothing ever happened, and they could be carrying the virus and spreading it around without even realizing it. We see a lot of older people affected by the virus that was probably passed on by younger people. So knowing this and looking at all the fatalities that took place from the virus, it's very, very hard to know how bad it is and how much worse it is than SARS or H1N1 or any of the other viruses. So at this point, what we're really, really trying to do is to limit the spread by doing the social distancing. And when we're talking distance, it's physical distance. Extreme social distancing, meaning extreme physical distance from other people. That's why they don't want more than, for instance, in the United States, it was said a group of 10 people together. Whereas in gatherings here in Montreal, they said 250 people. They don't want more than 50 people in restaurants. They just want to make sure that if it's circulating, it's not spreading to a large number of people.
Repeat the anti-inflammatories answer.
Oh, I'm going to repeat the anti-inflammatories answer because I think that maybe it wasn't clear, or maybe some people missed it. For anti-inflammatories, if you don't have to take them, don't take them. So don't take your ibuprofen, don't take your Advil if you don't have to. The reason why being that in observational studies in France and Austria, they found that young patients that came in and had to be intubated in the ICU and fared worse than some other young people had been taking anti-inflammatories at the onset of their symptoms. So they were not, when they were not feeling well, they started taking anti-inflammatories. It progressed all the way to them having to be intubated in the intensive care. And they've seen that one of the common things that they all had was that they had taken anti-inflammatories when they started feeling sick. So if you can avoid anti-inflammatories, if you're not feeling well, avoid them. If you take anti-inflammatories chronically or steroids, keep taking them. Don't discontinue your normal treatments at this point, especially if you're not infected with the COVID. The decision to discontinue medication should be taken with your primary health care provider if you're taking any of these types of medication. Okay, so let's look here. So I'm trying to read the name. Isla wants to know, should all yoga studios be closed down? At this point, this is from what I've gathered, the data that's been gathered around the world, looking at what South Korea has done, what Singapore has done, how China handled the crises, putting people in extreme isolation. I think that for a period of time, yoga studios should be closed just to make sure that no further spreading of the virus is going to take place. It's the best option to try and limit anything that is happening right now. If, however, you choose to keep your studio open, you're in one of those places where you still have that option, because right now everything is moving towards a close pretty much around the world as we're gathering more experience with how to deal with the virus. Make sure that you have good disinfections of mats, of props, if you choose to still use props, that you space out your students in class.
1 meter.
Well, at least more than 1 meter. You actually limit the class size to make sure that people have enough room to move, and also there's a good enough ventilation to breathe. In a hot room, it's not as easy, and so it could be a little bit more challenging to keep everything a little bit more sanitized, I would say.
How do you disinfect?
The way you would disinfect there's different cleaning formulas that are out that are available to people. If you don't have a commercial one, you could go and look up on the CDC, on the World Health Organization. There is a recipe on how to create a disinfectant, and it involves using bleach. So if I'm not mistaken, it's on I keep saying the CDC, but it's on the World Health Organization page that they post the recipe for a solution with bleach to try and disinfect mats and everything else in the studio. Okay, so I'm going to try and scroll down a little bit more and see what's happening. Yes, you better stay home if something is happening. Okay. Oh, we have people from Turkey and Brazil, Venezuela, Panama, Australia. Hello, everyone. By all means, if you want to ask questions in French, don't be shy. I could answer. If you want to write them in Spanish, you could do so as well, but I will answer in English because my Spanish is horrible.
Can you answer this comment? Is that accurate enough?
Here, Time Unwasted commented and said, no anti-inflammatory because our body's natural way of fighting against a virus. If you lower your body's natural response, your body can fight it as well. It's partially right. It's partially right. But in this case, with the coronavirus, what is very special is that it acts on certain receptors that are found in the lungs. So this is the reason why these patients fared much, much worse than people that didn't use them and had to be intubated. But anti-inflammatories, if you need them in a chronic condition, you still do need to take them. So I'm not going to say don't take them at all. But if it's because you're feeling all well, all of a sudden you feel like you have a cold or a flu or some sort of virus coming on, maybe try to avoid them. So that's what I wanted to say about this. So Geotai Yoga asks, how long can someone carry it asymptomatic? So at this point, what has been found is that someone can carry it for up to 14 days with a mean, if I'm not mistaken, a mean can go up to 20 days being completely asymptomatic. This is why in a number of countries at this point, they're asking people to quarantine themselves if they're coming back from abroad for up to 14 days after their trip, to make sure that if ever something were to show up, it's going to show up within the 14 days. I know that in Canada, that's a policy that we have. I'm not 100% sure that what is being observed in the USA or if it's what's being observed in Europe or in Australia. But 14 days here is the length of time, the quarantine time that is recommended, just to make sure that if any of the symptoms were to show up, you have time to either go consult, or if it's very mild in your case, stay home and keep it clean at home. Try not to infect the other people in the household. And Kayla in California asked, if you're already sick with a respiratory condition, should you get tested for COVID to be safe? So this is an excellent question, because depending on where you are, the availability of testing for COVID is going to fluctuate. In some places, it could be a lot easier than other places. Some places test systematically, while some places you really need to be showing symptoms. You need to have had a history of having traveled before. You need to have had a history of having had a close contact with someone that has traveled, or someone that was COVID positive. So depending on where you are and how easy it is to access the test, that is going to alter the answer to this question. But what is important to know also is that COVID is taking place at the same time as the flu season and as the common cold season. So it could well be just a common cold or even just the flu. You have to decide for yourself somewhat in terms of how sick you are, and if you present any of the risk factors, which are having been in contact with someone that has had COVID or tested positive for it, having traveled recently, presenting with onset of cold symptoms, cough, sneezing, congestion, muscle aches, high fevers, then by all means, yes, if it's possible for you to go and get tested, go and get tested for it. Okay.
It's the immunity one.
And here, the immunity one. Okay.
Improving.
How can you improve your immunity? Improving immunity it's actually a multifactorial, well, it's a multifactorial answer because there's no magic pill to do that. There's no magic pill. It's really a combination of things that you could do to help make sure that you remain healthy more than anything. It's very easy to go around and look for something that is going to boost your immunity, but what's going to help the most is keeping yourself hydrated, making sure that you eat well, that you eat enough, making sure that you get proper rest and also proper sleep. So napping during the daytime if you need to nap, but making sure you get enough hours of sleep to rebuild anything that could be damaged in your body, to reduce the inflammation. Sleep is completely crucial.
They manage their stress.
Yeah, the stress management is one of the biggest point here, especially in these times with this kind of virus where nobody really knows what is happening. I step out to work in the morning and I keep asking myself, well, I wonder if I'm going to get infected today, even though I take all my precautions. It's somewhat stressful, but what really helps is exercising. Exercising is an excellent immunity booster. Yoga, meditation is excellent to help and boost your immunity by reducing your stress, by down-regulating anything that could just rile up your sympathetic, your nervous system, making you more agitated, increasing the adrenaline levels in your body. You want to try and get those levels down by doing all these things. You want to make sure you get your rest. You want to make sure you get your exercise. You get your fresh air. Fresh air is one of the best things with the sun. And if you go in the sun, of course, sunscreen, please. But getting some sun, vitamin D is very good for mental health as well as fresh air. It's a very good solution for it. So
supplements,
for people,
yes or no? Supplements, yes or no?
Supplements, you can try supplements, but
at
this point, you have to make sure that it's not something that they're selling because it's COVID. If it's something that you've seen in the past that has helped you and better your health and make sure that you remain healthy and give you the extra minerals and vitamins, by all means continue doing so. But just the basic steps of good sleeping hygiene, good eating hygiene, good health habits, cleaning, washing your hands, keeping everything clean around you is going to help you far more than trying to get everything out of a pill at this point for the COVID. So for the cleaning, did I mean chlorine? Chlorine is in bleach. So yes, there's going to be chlorine in there. And the recipe is something that you will be able to find on the World Health Organization website. They might have also posted it on the CDC. I'm not 100% sure. But I know that I've had people close to me that looked up the recipe and are making their own cleaning solutions using bleach. And there's chlorine in the bleach if you wanted to know. So I'm going to try and scroll a little bit more. I never thought I would talk for this long. In anesthesia, we don't talk to people. We just say hello and we try to put them to sleep because we're all stressed out and, I'm kind of shy. So, so this is actually, I'm liking this. So, will the neti pot or breathing steam help? The answer here is no. It's not going to help. There's even a study that came out today, if I'm not mistaken, data from Taiwan or China. It's data from Asia that states that if you've been in contact with COVID, one thing that could be done is to actually use swabs to clean your nose to make sure that it doesn't go into your nasal mucosa and get absorbed. So using the neti pot or breathing steam is not really gonna help at this point, because if ever you were gonna have some droplets in your nose, it's not gonna wash it off, it's just gonna spread it around. So it's not something that's going to help. How does this all end? After 2 weeks lockdown, then what? No. Chances are it will not end after 2 weeks lockdown. The 2 weeks lockdown is really to give us an idea of how much we can stop the spread of the virus. It could last indefinitely, but I'm saying this not knowing what tomorrow is going to bring. So knowing this, it's the reason why the emphasis at this point, you probably have seen it everywhere, is wash hands, stay away from others, physically stay away from others, because we don't want to spread it. We want to make sure that it doesn't get more widespread and more people are infected and more people die from it. We don't know how long it's going to last, but if everybody plays their part and try to do their best with hygiene, with physical distance, then hopefully within 2 weeks we're going to see that exponential curve of cases, the explosion of cases is going to maybe plateau a little bit, or is not going to go as high as fast as we've been seeing it over the past couple of weeks.
How long might it last? Like July?
I can't say how long it's going to last. It's very, very, very hard to predict. It's something. If we're able to get a handle on the spread, then we're going to have a better idea of how long it's going to last. But at this point, we just have to play our part, supporting each other, making sure that if we get stressed, we have people to talk to, we have an activity to do, we can go walk outside and look at the sun, and hopefully it doesn't snow again, and in my case, and try and look at things in a positive light, thinking that by doing our part, hopefully things are going to progress much slower, and it's going to resolve itself faster, sooner than later, if we're helping out. Okay. Coping with anxiety. So that's a big one, coping with anxiety. There's struggling with the daily decisions, like little things like going food shopping or going to pick up something at the dry cleaners to say something. It's as I mentioned earlier, these are hard times. It's at the same time, the message that's being broadcast is to distance yourself from other people. But we're talking about physical distance. You need to have a group that is going to help you go through this, that is going to support you. It could be hard. You might be away from your family. I know that my family is scattered all over, and I know I can't go visit them because I could be a prime carrier. So using FaceTime, phone calls, emails, texting is what I resort to, just in order to keep close to people and to check on people, make sure they're okay through this ordeal, or if they need help, if they need anything. With decisions such as going food shopping, sometimes in some communities, you could have, there's services that are being organized for food deliveries for people that can't get out of the house, or people that are afraid of getting out of the house, or for the elderly that we don't really want them to go out and about, and as they're being more vulnerable to this virus. So you can always try and see if there's online shopping, grocery shopping that could be done with delivery service. The person can come and deliver at your door, and make sure that you wipe off the door handles, or if they've handled anything that could potentially get infected, you wipe it down with antiseptic wipes. Make sure you wash your fruits and your vegetables under running water. You can use soft soap, like soft dish soap, to clean any residue that could be present. Anybody that tended to the fruits, vegetables could have been sick. So you want to make sure that you wash anything that could be washed and wipe them down afterwards so that nothing stays or lives on anything that you're potentially going to ingest. So these are some little things you could do to try to cope with that anxiety. Also, if you have access to wipes, you have wipes, you can wipe door handles, you can guardrails, car door handles, anything that could alleviate your fear of catching the virus is something that potentially is going to help you cope with anxiety. And meditation, definitely meditation is a good tool. There's a lot of yoga studios right now that have closed down that offer a lot of classes online and a lot of meditation practices online as well. So don't be afraid to log in somewhere and catch a class and get your fix. And it's the same for yoga classes. Restorative yoga to help and bring the stress down is definitely going to help with the anxiety. But everybody's in the same boat, and we certainly have to support each other through this to make sure that we can cope with this and we come out stronger at the end of this whole thing.
And volunteer if you can for Meals on Wheels.
Yes. Also, public announcement. If you can, if you're willing, volunteer in this time of crisis. For instance, for Meals on Wheels, to deliver food to the elderly or the disabled. That would be very, very, very appreciated. And it's also a good way to make sure that these people are not exposing themselves to something that could be detrimental to their health. So definitely, it's a very good option. So now, all these questions, wow, I love it. I've been exposed. What do you recommend I do? So if you've been exposed, what I recommend you doing, if you don't have any symptoms at this point, stay home. Whatever you do, stay home. Don't go to work. Don't go to the gym. Don't go to the movie theater. Don't go spread whatever you could be carrying. A lot of younger people, meaning kids up to about 40, 45 years of age, don't necessarily show symptoms. So if you know you've been exposed, quarantine yourself and arrange to get yourself tested so that you know and you're not going to spread it to other people, and you can actually warn people you've been in contact with that you've been exposed to the virus and they might potentially need to be tested as well. So that would be one of the things that I would suggest to do if you've been exposed. Quarantine yourself, make sure you maintain the good sanitary sanitary habits, and try to arrange to get yourself tested, and also disclose to people that you've been exposed, and so that they don't go out and about and spread it and infect other people. Here, another question I have here: what's the best way to tell my peers and explain to them that they should work from home and take precautions? They think it's no big deal. Well, I have personal experience with this. So, I have a few brothers. One of them called me yesterday and said, okay, so here's the deal. So my girlfriend is kind of mad because I want to go to the gym, and she says that it's completely dangerous and stupid and I shouldn't go. And I think that she's overreacting. My answer to him was, I think it's a big deal and she's not overreacting, and you should not go to the gym because you're taking unnecessary risks. You could be the best person, wash your hands, do all the perfect things for the people around you. You're A1. But the next one next to you might not be A1 and doesn't really care. And you don't know, and by accident, you go touch where they've been and you infect yourself, and unknowingly you infect other people. That is taking unnecessary risks. We all think we're invincible until something happens. If you don't have to, don't. If you can work from home, at this point, work from home. You have this availability, use it. Doing so might save lives. It's not only nurses, respiratory therapists, OTs, doctors, radiology techs that are saving lives at the hospital. It's also every single person in the community that actually makes sure that they're not spreading the virus around by the little actions that they're taking on a daily basis. That is what is going to save the most lives at this point. So here, they call this social distancing.
Teachers adjusting students still.
Oh, teachers and okay. So in the studio, there's still teachers that are walking around and adjusting students, and they're proning for they're advocating for social distancing. This feels wrong. That is from Gemma Duane. And how do you approach this with social distancing? So at this point, yoga teachers, you could give verbal cues for assistance to your students in a yoga class if there's still studios open, so that they can correct their positioning. Try not to touch the students at all if ever possible, because you don't know if you're a carrier, you don't know if they're sick, or if you don't even know you're sick yet. You want to make sure that you avoid physical contact. That's the biggest point here. Avoid physical contacts. We're always tempted to go and tweak someone to help them out, but try to refrain from doing so right now in these days. Even though it might just be killing you inside, try not to touch people, just so that at least if something were to be present, if someone were to be sick, you wouldn't actually catch it yourself, or even give it to the next student if you don't get to wash your hands with soap and everything between each and every single student, which is what you're supposed to be doing. So definitely try not to touch students, even though you want to adjust them. Verbal cues, demonstrate, and it's something that you could do instead of trying to touch the students. Now, so if your yoga studio is still open, can you go, and should you not go? Well, there's nobody that is going to tell you that you're completely 100% forbidden to go to your yoga studio, unless you live in places like France and Italy and I guess Montreal, Canada, Spain, where everything is closed, and they actually ordered that we don't go to any recreational places at this point to limit the spread of infection.
New York and LA.
But and also I think right now there's a curfew in New Jersey, New York and LA are working on this. So there's quite a few places that are also involved in this ban of exercise places or gyms or yoga studios. But if you could avoid going, it would be very, very much so appreciated by the rest of the community, just to make sure that nothing is going to spread further, and that you're playing an important role in this pandemic that we're dealing with. So I would suggest you not to go. Studio owners I'm pretty sure, trying to find a way to be able to provide for their students, to provide for their clients. I'm 100% sure that studio owners do not want this pandemic to keep going. Obviously, there's the bottom line that needs to be addressed. Everybody in this downturn needs to make money, to make a living. But as we're stumbling around trying to get things done and trying to figure out what's going on, a solution is going to come about, and hopefully everybody is going to come out a winner from this. But you should avoid going to the studio if you can, just because it's so crucial at this point that we're just peaking exponentially in terms of explosion of cases, that we want to limit that spread of the virus. Stay home. So how bad is it to take the bus or public transit? Okay, so bus or public transit, you have to take your precautions. If you have to use the bus or public transit, Make sure that you have something to disinfect your hands. Obviously, you don't have sink and hot water and soap, or I should say lukewarm water and soap to wash your hands. Maybe if you wear gloves, if it's cold like it is here right now, you can wear your mitts and your gloves, and make sure that once you get home you wash them in case that there's something that could be on them afterwards. But if you wear disposable gloves to go around and about, once you throw them out, gloves are not 100% impermeable, so you have to throw them out. Once they're in the garbage, you need to wash your hands. Whenever you handle something with gloves, whether it is money or you touch something, before you do anything else, you throw them out, you wash your hands, you put on another pair of gloves. So you go through a lot of gloves if you were to respect that rule. But the best thing to do really is to wash your hands. Wash whenever possible. So in public transit, stay away from others if it's not a fully crowded bus or a subway or metro or tube. You try and stay away from others. If you want to protect yourself specifically, you could try and wear a face mask, but as I said before, it's not the solution. It's not the solution at this point. Someone's gonna cough and it is right next to you, whether you're wearing a mask or not. There's gonna be droplets on you if they don't use their elbows in order to protect others. So protect yourself if you are to take public transit. But if it's one of the ways you're using, just keep going at it. But the best way not to use public transit really is to stay home. So, more questions. Pregnancy. Pregnancy is a big one. So, pregnancy actually is a state where the ladies are a little bit immunosuppressed. So their immune system might not be 100% compared to prior to pregnancy, but with what has been found with the COVID, actually pregnant patients have not been, there hasn't been that many pregnant patients that have showed contagious status with the COVID. The transmission of the COVID to the baby, the incidence of that at this point on March 16th is 0. There's been one case in the UK that was reported yesterday of a newborn getting COVID, but it's thought to be from the environment, from someone in the environment that transmitted the COVID to the baby and the mother. So we call it vertical transmission of COVID. At this point, 0. At this point also, it has been found that there is no risk of in utero of the fetus to, and when I say vertical transmission, it could be during delivery. But when the baby is still in the uterus, there is also no risk of the virus to be transferred to the baby from the mother. At this point, no cases have been reported. At this point, there is none. Okay. In terms of breastfeeding, once again, no cases reported of virus transmitted to baby through breastfeeding. 0. So there's not a lot of data, but also there's not a lot of pregnant ladies that have been infected with COVID. Typically young, typically healthy patients in pregnancy. So the incidence of COVID in these patients much less than in the regular older population at large. So this is the status of pregnancy with COVID. However, I would still recommend to take the regular precautions for the pregnant ladies, making sure that they don't expose themselves to any of the other viruses, parvovirus, toxoplasmosis, any of the other conditions while they're pregnant. And by doing so, they should be able to avoid COVID at the same time.
Read this guy's comments.
Okay. Jyotai Yoga. We really need composure, fact-checking, and kindness. Thank you for providing. Oh, that's so sweet. Thank you.
Read it above, too.
So,
Can't tell you how precious it is.
sorry, I'm trying to read here. Can't tell how precious it is to have people reach out, comfort, and inform without inducing panic or turning to sarcasm. No sarcasm here. Towards what could be considered silly questions or uneducated comments. No. What I want to emphasize here is that I'm actually privileged in my life to be able to treat patients, to have patients trust me enough with their lives to treat them. It is my duty to make sure that I know everything I can about everything, to do my best to treat them as best as I can. So if I can give back and inform people so that in turn these people can actually inform other people and make sure that they're taking right decisions in crisis situation, it's definitely something that I strive to, and it's definitely something that I'm going to keep going to make sure that everybody is well informed. Everybody can comfort other people knowing that someone out there is able to give them information. So by all means, please feel free to reach out if you have any further questions. I'm doing at least 5 to 6 hours a day of reading on COVID, so I think I'm becoming a lot better with this problem. What about anti-inflammatories like apple cider vinegar?
That's the same medication question. Like, don't
apply. So for the apple cider vinegar, I personally, this is a personal reference, don't have information about the anti-inflammatory properties of the apple cider vinegar. So in my understanding and in my opinion as a professional, I can't recommend it. If it's something that works for you, by all means keep using it, but I can't say yes, take apple cider vinegar. This is going to help with whatever condition. But if you use it as an anti-inflammatory, on the contrary, I can't tell you that it does really act as an anti-inflammatory and is going to aggravate a potential case of COVID if ever you were to catch it. So
there's no data.
There's absolutely no data for the apple cider vinegar, and I can't really give a professional opinion about taking it or not taking it, just from my professional opinion. And so exercising. How should I exercise? Is it okay to run outside in the city? Yes, you should exercise. Running outside in the city, I think, if it's not too dangerous of a city where you can run outside, is actually a very good thing, because you're actually breathing in fresh air. You're actually soaking up the sun, or depending where you are, the rain or the snow. But you're still outside. You're still breathing fresh air. You're still breathing air that doesn't have droplets of COVID. So it's definitely something that it's going to help not only with your mood, but that is going to help with your cardiovascular system, with your musculatory system. Anxiety. It's a big plus. So by all means, go run outside, walk outside, hike outside. If you don't want to do it alone and you have a running partner, just make sure they're far enough, because I know sometimes when people run, they can spit and stuff. So you don't want to be too close. Just have a safe distance, at least a meter, and everything should be good. Everything should be good. Keep a little distance and everything should be good. So I have about a minute remaining. I have time for maybe 1 or 2 more questions.
How to keep yourself protected.
How to keep yourself protected.
Yeah.
So the last one. Okay, I'm answering this last question. Best way to keep yourself protected. Stay home. First one. Stay home, stay home, stay home. Hygiene. Second one. Wash your hands. Lukewarm water and soap. 20 seconds. Everywhere on the World Health Organization website, I think, and also Health Canada, they outline how to wash your hands. It should take a good 20 seconds. Dry your hands with paper towels. I know it sounds wasteful, but at least it's a way to not contaminate compared to using a cloth towel. Also, if you're working somewhere where you could come in contact with COVID, strip down, get changed without getting in before getting into the house. Take off your shoes, shower. Don't touch your face. Don't touch your eyes. Don't touch your mouth. Don't pick your nose. None of the mucosa, none of the surfaces here where anything could be absorbed can be touched, because you could potentially catch it that way. And the last one, make sure that if you need to cough or anything, do it in your elbow. And most importantly, stay home. Thank you so much for listening. I hope I wasn't rambling too much. And stay well, everyone. Stay well.